Hey, future medics, you're doing great learning these drug cards, and we're just gonna keep going. This one you're not gonna give that often, but if you do, it's a sign that things have gone off of the rails. It's sodium bicarbonate. It is an electrolyte and an alkalinizing agent that we give to patients that are critical and in metabolic acidoses. This drug works as a buffer, acting to raise the pH when it's become dangerously low and acidic. And we're gonna see these in situations like cardiac arrest with prolonged downtime, TCA overdoses, hyperkalemia, and other drug overdoses that will send the patient into acidosis. The typical dose is 1 milliequivalent. We haven't seen that yet. 1 milliequivalent is the dose per kilogram, IV or IO. It can be repeated depending on your local protocols, but it's pretty common to see a standard adult dose of just 100 milliequivalents. This has an immediate onset with a duration of 1 to 2 hours. So for your contraindications, we're not going to give this to anyone who is already very alkaline. Their pH is already too basic, and adding a base like sodium bicarbonate is going to make things worse. You're also not going to give it with hypokalemia. It's also going to make things worse. Here's something important to know about sodium bicarb. It will precipitate and clog your line with calcium. It will. If you only have one line, you only have one IV, and you have to give the medications through the same IV, you need to flush very, very well between these two medications. Sodium bicarb and calcium will make a rock. They will. You will not be able to use that line. If you can flush 2 flushes of saline between these medications, you should be good. But just know that. Very, very important. Okay, here's your takeaway. Sodium bicarb, it's not a quick fix, but it is a Hail Mary that you can hopefully get this patient to the hospital where they can actually get some blood gases done and get fixed correctly, okay? It's important to know why you are using it and when to use it. Awesome. That's another one knocked out. You're doing so good on this series, and you're going to be ready for school in no time.